Hi, my name is Danny Urbano, and I will show you the most commonly used orthopedics testing in clinic setting and its components. So the first one is going to be cervical. So I'm going to go from cervical all the way to the knee. The first one is going to be called Sperlings. For this test, the patient is going to extend his neck. Then it's going to rotate to the side that hurts. So in this case, this side, the left one. And then the therapist will apply pressure downwards. A positive sign for here, it will indicate radiating pain down the upper extremity. Now, test to corroborate the symptoms is actually called cervical distraction. For this one, the patient will extend slightly the neck, and I will put my hands in the occipital region in the jaw, and I will apply pressure upwards. A positive sign will be a reduction of the symptoms. If we keep going down the chain, the next commonly used test for thoracic outlet syndrome is called Edison's. For this test, I will grab the side that hurts. Now the arm will be externally rotated, an extension and abduction. From here, I will feel the radial pulse. For this position, the patient will rotate the head to the side that hurts and extends. And then from here, they will breathe in and they will hold their breath. A positive sign will be a reproduction of symptoms or a diminishing pulse on the radial side. If we continue in this area, the next area is going to be the shoulder. For this test, it's called aptly scratch. For this position, can you face the wall? Now, aptly scratch test is basically reaching behind the back from the up and down position. So this hand will go up and try to reach your back, and this hand will go be under and will try to reach your back. And what you want to try to do is basically look for asymmetries as you switch sides, and then go the other way. This hand will go up, and this guy will go from the bottom part. A positive sign is reproduction of symptoms or tightness, and indicating either rotator cuff weakness or tendonitis or muscle weakness. Now let's face the camera again. The next test for the shoulder is called speech test. For this position, the hand will be supinated. The patient will hold the arm up, and then from here, they will resist the position. A positive sign will be a reproduction of symptoms on the front of the shoulder, indicating bicipital tendonitis. The next test is called empty can test. For this position, the patient will flex the shoulders to 90 degrees and about 90 degrees of abduction, and the thumb will be face down. They will resist pressure here. A positive sign will indicate either reproduction of pain or also in any tendonitis or any kind of possible tear in the rotator cuff, specifically supraspinatus. If we keep going down the chain, the next test will be for the wrist, especially for medial nerve compression. So for this position, the patient will flex both of their wrists in front of their chest, and they will keep that position for a minute. A positive sign will actually be tingling down the thumb, the index finger, and the lateral part or the middle finger. You can rest. If we keep going down the chain, the next test will be actually for the lumbar spine. So let's lay down facing up. This side I have here. So the next test is called straight leg raise, and then you test the side that is asymptomatic, and then you go into the side that's symptomatic. In this case, I'm going to choose the symptomatic side to be the left side. From here, you start bringing the leg up, and then the patient will tell you when it hurts. If the pain is reproduced around 35 to 70 degrees, it indicates any disc entrapment or compression. If it's above 70 degrees, it indicates any issues with the sacroiliac joint. The next test involving the sacroiliac joint is actually called sacroiliac compression test. For this test, you find the ASIS on both sides. From here, you apply dorsal and posterior compression and lateral compression. A positive test will indicate reproduction of symptoms. If we keep going down the chain, next test for the knee is actually going to be aptly compression and decompression. For this one, can you face down? Thank you. For this test, you're going to bend the knee. You can kind of stabilize the joint a little bit here. From here, you're going to press downwards and rotate the tibia in and out, internally and externally. A positive sign is reproduction of symptoms or decrease of range of motion. along with pain. Something that corroborates the symptoms also is Apley's decompression, which is actually you decompress the knee and then you internally and externally rotate the knee. A positive sign is basically too much movement, or in addition with painful signs too. Can you face up now? The next test is called Lachman test. This test for ACL. So you bend the knee to about 30 degrees. You place the tibia in about a little bit of external rotation, and from there you pull anteriorly. A positive sign will actually indicate is usually shown with like a excessive soft feel or a little bit of pain, and then in more translation compared to the side that doesn't hurt. So those are the most commonly used tests for clinic for orthopedic testing and its components. Thank you.